Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Lurasidone. Its brand name is Latuda. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Lurasidone hydrochloride is an atypical antipsychotic agent. It acts as an agonist at both dopamine D2 receptors and serotonin 5-HT2A receptors. It also has partial agonistic activity at some alpha-adrenergic receptors and is a partial agonist at 5-HT1A receptors. In terms of indications for use, Lurasidone or Latuda can be used in the treatment of the depressed phase in bipolar as an adjunct therapy paired up with lithium or valproate. And it's also indicated to be used in the depressed phase of bipolar as monotherapy. And lastly, for indications, it is indicated to be used in the treatment of schizophrenia. Now, before somebody was to use Lurasidone, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. It would be contraindicated in patients who are using strong CYP3A4 inducers. Some examples of these would be rifampin, St. John's wort, or carbamazepine. And it would also be contraindicated in patients who are using strong CYP3A4 inhibitors. Some examples of these would be ketoconazole, clarithromycin, or ritonavir. And finally, for contraindications, Lurasidone would be contraindicated in patients who have a hypersensitivity to Lurasidone or any other component of the product. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid the use of this medication to treat things like delirium or dementia in the elderly population, as it may put them at an increased risk of experiencing a cerebrovascular accident, and their mortality would increase as well. Orthostatic hypotension, as well as syncope, may occur in patients using Lurasidone. This would more commonly occur during initiation of therapy or during increases in dose. Patients should be made aware that the use of antipsychotics may decrease their ability to control their core body temperature. So they would want to use caution when doing strenuous exercise or when they're exposed to heat, as well as if they're using anticholinergic medications or they may be dehydrated. Patients with diabetes mellitus or risk factors to develop diabetes may be at an increased risk of experiencing hyperglycemia. Dyslipidemias have been reported with the use of atypical antipsychotics. Patients should be made aware that weight gain may occur with the use of antipsychotics. Esophageal dysmotility may occur, which could lead to aspiration and cause pneumonia. It's important that patients are made aware that both cognitive and motor impairment may occur with the use of this medication. Patients with a history of seizures, or patients who have a condition that may lower the seizure threshold, may put themselves at an increased risk of experiencing a seizure while using Lurasidone. And finally, for precautions, patients should be made aware that tardive dyskinesias have occurred, and in some situations they were irreversible. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Latuda or Lurasidone, they can expect to receive their dose in tablet form. So when patients use Lurasidone with lithium or valproate during the depressed phase in bipolar, they would typically receive a dose of 20 milligrams daily that should be taken with food. The maximum dose in this situation would be 120 milligrams daily. When a patient is using Lurasidone to treat schizophrenia, they would typically use 40 milligrams once daily, again with a meal. The maximum dose in this situation would be 160 milligrams daily. One thing that it is important to make sure patients are made aware of is that when they take their medication with a meal, the meal should consist of at least 350 calories. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Lurasidone or Latuda, so I'll go over some of those here now. Dyslipidemias can happen anywhere between 4 and 14% of the time. Anywhere from 2 to 12% of patients may see a rise in their glucose levels. Weight gain can happen between 3 and 7% of the time. Nausea can happen in 10 or 17% of patients, and vomiting can happen between 2 and 9% of the time. Akathisias have been reported in 5 to 22% of patients, and up to 36% of patients may experience extrapyramidal side effects. Up to 25% of patients may experience somnolence, but this may be as low as 7%, and about 4 to 5% of patients may experience anxiety. Now, some more rare but serious side effects would be a cerebrovascular accident, orthostatic hypotension, the development of suicidal thoughts or ideation, neuroleptic malignant syndrome, and finally, tardive dyskinesias. That's all we're going to talk about today with Lurasidone or Latuda. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.